Welcome to True Out Tuesday, and the truth will set you free. But resistance is going to be big. Now, a patient brought me this cup, okay, and I thought it was really cool. When injustice becomes law, resistance becomes duty. It is our duty to fight an unjust system. So we're going to go in and do a whole series of talks on how you should have control of your own body. Why is that controversial? Doesn't this sound weird? No, you no longer own your own body. In fact, your medical doctor can't give good decisions on that. And in fact, the state now owns you. And they should be the ones to decide on your medical care. Forget religious freedom, we have the state. Thank you. Okay, so don't comply. What we're going to talk about tonight is, again, lack of critical thinking. And I'm just going to bring up things that are very, very rare. How many people over 50 in this room? Okay, so you still remember common sense, yes? Yes? Yeah. I know, it's a distant memory, okay? But we're going to go through and we're going to talk about just normal stuff when it comes to this. Now, I'm speaking in Kansas Saturday afternoon in Overland Park, and it's going to be 2 hours. So it'll be simulcast. So if you don't want to fly out to Kansas, go to chiropractic.org/summit19. But it's going to be simulcast, and then you can also get it on there. It's I've got to tell you, the guy in the upper left corner is Deed Harrison. Brilliant. I mean, he's like a nerd's dream. Talks about, force loading, data points. I mean, just, I want to go see him. He's cool.
What's the topic going to be?
It's, well, they listed it as validating chiropractic outcomes. Okay? It's more common sense, factual data, and how 86% of the schools now are no longer teaching actual chiropractic. They're teaching how to refer out. They're trying to medicalize the system, which means that the art of your body having an innate inborn intelligence healing itself will no longer be taught. Okay, so, so we're going to do the best we can, but eventually this information will start a new profession. Okay, or, because it can't be lost. So let's look at the overlooked problems. Okay, last week we talked about shoulder, elbow, wrist issues pertaining to the neck. Now we're going to look at hip, knee, and foot issues and how that pertains to overall health. Because in really stupid world, okay, now have you ever heard of workman's compensation? Yes. Okay, well, in a work comp doctor, you have blind leading the blind, okay? You got a medical doctor that knows very, very little about neurology, anatomy, and physiology, but he's paid to assess a person. So if a person falls and gets hurt, and they may be walking around, but now it's not really the health of the person. I know that would make sense. No, this is who's responsible to pay for the stupid friggin' care. Okay, so you have the person walking around limping. Now they might want to actually work. Okay, really, because work is fun. And if you're put on disability, you're not getting as much pay. So disability sucks. There are very, very few people that want to milk the system. But, if you're hurt, you want to get back to work. However, can everybody understand that if you twist an ankle, knee, foot, or anything, and you start walking like this, that this may negatively affect another part of your body? Maybe the other side might have to have double force loading, okay? But in stupid world, you only treat the site of injury. And if you're a work comp doctor, then you can't treat any part of the other body, okay? And back when I've had, because I won't take cases like this, if one of my patients has to do it, I'll say, okay, well, I'm just going to fix you. You can't. No, I'm only supposed to touch the left leg. It's crazy. But let's look at this, because there's neurogenic, okay, a nervous system is going to be involved in all three of these. If I step on your foot, that's going to put your body in a stress state. Does that make sense? If you have any type of irritation, it's going to put your body in an autonomic dysfunction. Vascular. Okay, so we know that the heart is the main pump, but also all your arteries are opening and closing, dilation and constriction to help move that blood flow along. So the heart's just the initiator. So if you have a sedentary lifestyle, you're talking lymph flow is going to back up. You're talking it's not going to work right, or jobs can negatively affect how the body is flowing. Toxic food can affect it. And then you have mechanical distortions, literally physical traumas that alter it. So this is for people that have 3 minutes to listen to this and no more. This is the solution. Isn't that nice? I haven't described the problem, but I'm just going to show the solution. So that way you don't get too much shit on the comments. Okay, so you get a full set of x-rays. Okay, now in stupid world, they just take the picture of the area involved. Now that is so ridiculous when you look at 90% of the nerves that come off the spine, there's no nociceptive fibrings. That means that there's no awareness or pain fibers in 90% of the body. So 90% of the nerves coming off, that means you got to have more than 90% compromised in order to be aware of it. And what I literally will tell my patients, okay, and I know some patients in here will, corroborate this. Doc, oh man, I got this radiating pain. It's burning out here, and it was just like that night, and I go, look, I don't want to hear this. It's irritating to me. And it's not going to help me give you care. The best information that you could give me is 10% at most. And it's only your enthusiasm that's reinforcing that painful contact in your brain. So it's not helping you to tell me. It's not helping me to get that information. I'd rather use an objective analysis to do a thorough assessment of stuff that you're not even aware of. Okay? But, most doctors don't do that because they care about people's feelings. Okay? But I'd rather be honest and say, no, what you can tell me isn't really going to be helpful. I know it's something you want to relate, but looking at an objective analysis of stuff that doesn't bug you to find to find more problems that you might not be aware of that are contributing factors. Okay, does that make sense? Okay, because, symptoms are important to a point, but people harp on them and think that this is the most important aspect, and it's not. It's a clue. And I'm going to show you how other aspects that people do not complain about are contributing factors to damage of the hip, knee, and foot. Once the pelvis and lumbar biomechanics is restored, start on hip exercises. That means if you have a tourniquet or you have compromised blood supply or nerve supply or altered mechanics, and someone is telling you to exercise it, is that smart or stupid? All the 50-year-olds, come on, what is it? Stupid. Okay, good. Just checking. Wanted to. Okay, yeah. So you have to restore the biomechanics, the blood supply, nerve supply, and then the thing goes, it makes sense to start strengthening it. Balance foot and calf exercises with lumbar and pelvic restoration. Get proper supplements and nutrition to clean up the blood, because you got to figure each bone, each joint, you've got two bones coming together surrounded by a capsule filled with a super filtrated blood called synovial fluid. You have tendons that cross that joint that have a bursa sac on it, okay? And this tendinitis could be from there. So you're looking at blood supply and nerve supply to that joint will totally reverse tendinitis, bursitis, and synovial capsule problems. Eliminate prescriptions that are toxic to tissue regeneration. Does this make sense? Hi, I'm going to give you a non-steroidal anti-inflammatory. I know it destroys the building block of cartilage, but by God, you're going to be a little bit comfortable. Okay, we had a young boy in here today taking shots, okay, for an autoimmune condition that he doesn't have. Now, it's weakening his overall immune system. They've never done a study on teenagers on this long term to see how it's going to negatively affect the body. and the drug that they're shooting him with, he still hurts. And so I said, buddy, you still hurt, don't you? Yeah, I do. Okay, it's not working. No, it's not. Okay, so let's find an alternative. Does that make sense? Okay, so let's look at this. And this is hugely important when you're looking at a good hip on the top left, degenerated hip on the bottom, and degenerated other hip on the other side. But people will say it's bone on bone. Okay, they'll always say it's bone on bone. Now let's look at what we're looking at here. This is the pelvis. Okay, now the bone that we're looking at is the femur that goes inside this acetabulum. Now it looks like a really cool ball going up into a socket, doesn't it? Because when you're looking at that upper left-hand picture, you're seeing the femur coming up and a really cool space there, aren't you? Except that's not what you're looking at. Okay, what you're looking at a three-dimensional object that shadows, okay, in a two-dimensional presentation. Or what you're looking at, you're actually looking through this part here at the front, you're looking through this part here on the back, and the only thing you're seeing is the roof that's en face. Okay, now there's a law, bone is laid down where it's needed or absorbed where it's not. So let's say that you have compromised blood supply, nerve supply, or biomechanics to this joint, okay? Is that going to be a healthy joint, or do you think it might bang around a bit? It's going to bang around a bit, okay? So that's going to thicken the bone in the front and thicken the bone in the back, okay? That's called Wolff's Law. So it's going to be banging around back and forth. And so what you're going to see, even though you've got the femur head coming up, and you've got the joint capsule, the acetabulum here, if it sloshes around, because let's say that you have poor diet, you've got poor synovial fluid production. Let's say you have compromised nerve supply or blood supply to that. Let's say you twisted an ankle multiple times, okay, and you have that altered mechanics. So you're not going to have healthy synovial fluid production, so it's like a hydraulic joint that doesn't have it, so it will slosh around a bit. And what are you going to see? What are you going to feel or hear, or to give you an idea of destabilization of a hip? Popping and cracking. Doc, I don't know what it is, but I want to lift this thing. It pops like crazy. Yeah, that's pressure building up and pressure releasing. It means you got something messed up. Okay, and I can say something messed up because that's as close as what you can get, because you've got to assess the stability of the pelvis, you've got to assess the nerve supply to it, you've got to look at all the structures involved. Do you think maybe a flattening of the feet or bunion formation or altered mechanics of the foot might negatively affect the hip? Yes or yes? Yeah, so you got to look at the whole thing. I'm just talking common sense here. So what we're doing when you're looking at this, even though the bottom hips over there, you can't see that clear, pretty joint, okay? What we're going to do now is we're going to bend that body on one side, and that's going to create a negative pressure, and we're going to see that. We're going to bend it on the other side and take it. And it's not just straight where it's two-dimension. When you're bending, you've got a hip coming at an angle of around 125 degrees. You've got the pelvis, which is at a completely funky angle, okay? And this pelvis moves, so you've got all these different things. So it just gives you a little bit more data if you're taking a stress x-ray to assess the disc in here, but also to assess the structure. Does that make sense? So what you're gonna see, and I want you to look at that upper left one really clear, you can see the ball coming up. Okay, now I'm going to show you something that you didn't see before. See about halfway down the line, okay, on that ball, that there's a white line that goes kind of like this coming down? You can see that now? That's the back half of the joint. Okay, so you're literally looking through, okay, that femur bone into the back half of the acetabulum. Oh. Okay? Okay, I know, it's cool. We used to call it take the x-ray drugs, man. Yeah, you'll see some really cool shit. Okay, but it's really, because you're looking at a three-dimensional object. So each one of those lines in there really makes sense. However, if you've had, and I'm just talking compromised blood supply, you get this synovial capsule that doesn't have that pressure, what's the patient going to notice? Some popping and clickling. It's no big deal, right? Okay, unless you happen to be a teenager working out at the gymnasium or something, doing gymnastics, and you've had, you're a teenager, so you've had, 54, 55 vaccines, you've had a couple of courses of antibiotics, you go to the fast food joint, okay, so you're getting some glyphosate, your gut is leaky, and your blood is toxic, okay? So what you're gonna notice from that, you have bad skin, poor sleep patterns, impulse control, but your hip is popping and cracking. Okay, and they come in here because they got a hip problem, okay, when it's really an overall gut system. Does this make sense so far? Okay, so when you're looking at that picture in the middle, where you have the femur coming in, and now you can see all the capsular ligaments around there. Now that whole friggin' thing is filled with synovial fluid, but it's also adding some support and some mobility. So you're gonna start to see on these degenerated hips that we're gonna run through is that capsule pulls. It's going to pull on that joint in an abnormal fashion. And this is where bone spurs come from. They are not bone spurs. They don't just grow randomly, okay? Like doctors will tell you, gee, you got bone spurs. No, that's that joint capsule that's attached to the bone. The biomechanics get altered, so the joint capsule has to be utilized beyond its design parameters. So it becomes thicker. Okay, the flexible aspect of it, the amino acids in there that need to have a flexible joint become to not, it's too expensive to build. So it starts to ossify. And ignorant doctors will say calcium deposits. It's not calcium deposits. It's an ossification process because the ligaments are being utilized beyond their design parameters. Okay, does that make sense? And so that ossification can actually be resorbed. Why? Because Wolff's Law said bones lay down where it's needed to resorb where it's not. So I want you to look at that top picture in the middle, and that is what you're actually looking at. So you're looking through that bone on the front, you're looking through the bone on the back, okay? And so when a doctor says it's bone on bone, and I see a person that walked into my office and they're sitting like you, I tell them, no, they're wrong, because that baby bends to 90 degrees. Okay, does that make sense? Okay, and I'll show you. And again, this is just that, God, I forgot. What was it called again? Common sense. Okay, thank you. You keep me up on that. Okay, I don't want to tell you this guy's name because I didn't ask him for permission to use his name, but this is a bitchin' guy, okay? Really, really cool. He's a couple of Super Bowls, played in the big leagues for 20 years. Okay, he jogs every day. This guy is a tank. 59 years old, perfect hips. 2 Super Bowls, 20 years of playing, and I'm talking, it ain't playing nice. Okay, running and getting hit. You're looking at 2 perfect hips. So when moron doctors say, oh, you're 40, you gotta expect a little wear and tear. No, that is not true. That is crazy. Okay, it's not understanding that the body can function correctly. Now here's a girl, 54 years old. You'll see on the right-hand side of the picture, which is her left hip, a perfect, beautiful hip. And you're looking at the other side. Now this was some type of weird congenital anomaly, and we'll see this a lot, where either the hip wasn't attached to the socket, there could have been a trauma growing up, there's something not right. But now she would ride horses, she could jog, she could run, she could do everything. And only the last few years is it starting to irritate. So you have a hip that's completely distorted, that worked for nearly half a century, and now the joint pain is getting too much for her, okay? And then that's appropriate. However, when you're looking at this, okay, and I want to walk you through a thorough assessment, but just look at the distortion of that hip. Now she's able to do a lot of things. She can walk, she can ride horses, she can do a bunch of stuff. And this is what we're assessing on her body. We're doing a bending to one side, bending to the other. But when you're looking at the film on the left-hand side, that's her standing up. So do you think that lateral deviation of the rib cage might have some abnormal force loading? Could it be compensatory? Okay, it kind of the body leaning away from the affected side. Would that make sense? Okay, could that negatively affect the shoulder or joint or nerves that come in the rib cage? So when I talk about, and again, this is just bringing common sense back into healthcare, look at the whole body! Okay? It's like so stupid to only pay attention to the area of trauma. It doesn't make any sense whatsoever. What do they teach in doc in school? Only pay attention to the area, right?
No, we learned to look at the whole body. I went to school back when you did.
Oh, 20 years old. Okay, we need a new doc in here. Okay, so, and then we're doing bending films one side, bending films the other way to look at disc injuries. So this makes sense. Now here's a gal that didn't need a hip replacement that got a hip replacement. Okay, why? Because she had pain in the hip. And now you'll see the red line on that middle picture. That's the second lumbar area, okay? And there's things called dermatomes, and there's an area of skin supplied by a specific nerve root. And typically this is going to be the 6th cervical nerve, this one's the 7th, this one's the 8th. So based on the amount, on the location of symptoms, you can kind of get if it's a specific nerve root. Well, the hip joint is supplied by the 2nd lumbar. Okay, so this means the musculature, the area is going to be supplied by that. So when I'm looking at this gal who has 2 pretty decent hips, okay, up there, and you're going to see the perfect right hip, and the one on the top up there, there's very minimal distortion. It's actually in pretty good shape. There's no distortion of the head. But what she does have, she has an extremely huge bone spur at L2. So that means you're talking a 20-year-old injury at that L2 or the thoracolumbar junction. So that means for 20 years, she's had compromised nerve supply. Now this gal was a jazzercise instructor. She loves bike riding, all the other stuff. And what did the doctor say? Let's just fix it. Why keep dealing with the pain? Okay, yes, I'm sure there were some injections and drugs in there, but they replaced it. Now, when you're, say 58, 59 years old, the hips are going to last around 10 to 15 years. No, they did not put a zipper in it. That's sick. Okay. But you're talking 70 years old or something, she's going to have it replaced or something else. Plus you have a foreign object in there that is an inflammatory, it's going to have a negative. It's going to have an increased immune system response. So I'm just talking common sense. If you need it, it makes sense to get it. If you don't, it doesn't make sense to get it. Okay? Now, here's a gal with a very severely damaged hip. Okay, and we worked with her, and that's her, no hip replacement, doing the splits. And I mean, granted, she's ridiculously cool, but you can see, and the reason I bring this up is because we're looking at an incredibly distorted hip that the girl used for half a century. We're looking for, at a minorly distorted hip, that because of the discomfort and she was talked into getting a hip replacement. And this gal, a distorted hip, but again, is that opening that we're looking at really small, or is the bone built up around it because of the altered mechanics? I know, there's a couple of orthopedic guys going, wow, that makes so much sense. Okay, so when we look at this, look at how the degeneration forms, because it's not degeneration. This is called osteoarthritis. Arthritis, arth means joint, itis means inflammation. Arthritis means joint inflammation. Now, osteoarthritis is a non-inflammatory joint inflammation. Don't laugh, sir. This is real medical stuff. That was not a joke. I know. See, when you make a mistake and you're a doctor, you can hide it by using Latin. Okay? So we just call it, you could also call it degenerative disc disease or degenerative joint disease, DJD, and then you look it up, and it's not degeneration at all. It turns out that it's a metabolic response, that it's not even a disease, it's the end result of a trauma. So this is, when they say it's worn out, it's degenerative joint disease, that's totally wrong, because if you look at every biomechanics Bible, this is the end result of a trauma, an actual trauma to the joint. So what can you do? you can fix the friggin' trauma. Okay, does that make sense? Or you can not fix the trauma, take a medication, and just deal with it. Okay, so again, I just want to show you a couple, but when you're looking at the distorted joint, the after joint, you're still seeing the bone spur there. Because what is the bone spur? It's the body adapting. It's changing the shape of the bone. It's changing everything around there to adapt. Your body is that smart. It's friggin' brilliant. You don't need total perfect symmetry. Okay, if you've had a trauma, your body can adapt to it. Okay, and that adaptation can actually make you live and thrive on this planet. Okay, so we have to look at the body a little bit different. Now this is interesting. In Crazy World, they will shoot you with cortisone. Okay, and some people will say, gee, doc, it felt really good. Okay, and then it comes back. Because is anyone suffering from cortisone deficiency in their joints? I know. You know there's one guy, well, I got the shot and it really helped me. Okay, well, it destroys joint cartilage. So not only is that a stupid thing, hey, I've got a couple of therapies that we can give to your joint. One of them is going to be medication therapies. They're called non-steroidal anti-inflammatories that destroy the joint cartilage. Or I can inject you with this. And in a double-blind placebo-controlled trial where they compared saline injections with cortisone, it turns out the cortisone destroyed the joint cartilage and didn't really help the pain. So bend over, let me shoot you. It's insane. How could you? And then, again, is a knee problem really a problem of just the knee? Could it possibly be? Yeah, you're right. A guy laying in bed, his girlfriend comes up and beats him in the knee with a baseball bat. That's the only type of circumstance. There won't be a foot involved or hip. But in normal world, okay, can you ever have a knee problem without having a pelvic compensation? No, you got to look at the whole body every time. But this is just nuts. The use of corticosteroid injections to treat knee osteoarthritis is based on medicine's capacity to reduce inflammation, but corticosteroids have also been reported to have destructive effects on cartilage. Inflammation is a healing process of the body. Inflammation is how your body regenerates tissue. The fact that this guy thinks that reducing the inflammation will help regenerate the joint, dude, go back, take anatomy, okay? You'll find out inflammation is actually how the body regenerates tissue. Okay, so let's look at Tylenol and the non-steroidal anti-inflammatories. Now, I mean, you know, granted it just destroys the joint cartilage, but that's not the extent of it. It can blow holes in your intestinal tract. You're talking destroys the mucous membranes of the intestinal tract, weakening your immune system. And then what do you get? Heart problems, hearing loss, GI bleeding, GI complications, heart failure. And this is the Motrin, Advil, and Aleve that your doctor recommends. Wow, crazy. Okay, dulled emotional responses, so at least you won't care. Okay, so when you look at this, anytime you have a lower extremity problem, okay, and I'm talking foot, knee, and hip, is your gait good or is your gait going to be off? Okay, so now here's why you never wanted to have me as an instructor, a write-in anatomy. And I would have a question written there and you had to hand write out your answer. Name the muscle that crosses the posterior aspect of the sacroiliac joint. You had to write in, there isn't one. I know, can you imagine those the people that want to get straight A's all the time? And they go, what does he mean? Oh God, it was so much fun. Oh God. I shouldn't reveal that, but it was really fun, okay? So that means that this is a perfect joint. It never wears out. It turns out you're a good design. But however, if you've had long-term lower extremity issues, this is going to start to wear out. Now, we recommend a trochanter support, which is super easy. It costs around $9, $10. You get it from Mayer Distributing. You pretty much stabilize the pelvis, and within 4 to 8 weeks later, depending on how much damage it is, you throw it away. So it's very, very simple. But you have to look, anytime you've got hip, knee, or foot issues, if you're not paying attention to the sacroiliac joint, you're missing everything. And if you think it's a muscle involvement, it's impossible. Now, anyone up here, if you stand here, I'll step on your right foot, causing extreme pain. Instantly, your left gluteus will fire off. Your left gluteus medius, which is the main hip stabilizer for the other side. That means your butt muscle. So if I stand on one side, the other side gluteus medius is going to fire off. Why? Because watch this, okay? I'm lifting one leg. How is my body not falling off to the side? Because my right gluteus medius is in spasm right now. Okay, does that make sense? So you're going to have these alternate firing off of the muscles involuntarily to stabilize and to get the weight shifted off of the affected side. Does that make sense? Now, there is a muscle that crosses the sacroiliac joint on the front. It's called the piriformis. So if anybody ever says that you have Beach syndrome, okay, run, because that's a person that doesn't understand anatomy or physiology. Piriformis syndrome. We don't know why that muscle is spasming. All we want to do is shoot it with cortisone or some type of nerve deadening agent. Okay, no, it's crazy. If the piriformis is spasming and that's the only muscle that crosses the sacroiliac joint, how about looking at the integrity of the sacroiliac joint? And then if you want to be a real doctor, you're going to think, damn, let's look at the feet. How are their biomechanics? Let's look at the stability. Does that make sense? So you got to look at everything. Muscles do not react on their own. Now, when we get somebody in here with a pelvis problem. Now, the pelvis houses half of the autonomic nervous system. So you're talking the rest, digest, and repair. So if you got a pelvis problem, does that mean the nerves that come out and supply all the organ tissue could be negatively affected? Abso-friggin-lutely, okay? Bowel and bladder control issues, prostate issues, slow gastric motility. So you're talking one poop a day if you're lucky. Sleep patterns, good or poor? What do you think? Poor. Okay, so you got to ask all these questions. And the person's coming in, gee, doc, I just came in here for a bad knee. I didn't know this was going to affect my prostate. Okay? But you got to look at everything. And again, it is that common sense approach. Because that's what we're looking for. Because, bowel and bladder control, sexual dysfunction. I mean, this is everything. That pelvis is really, really important. And since that supports the whole body, but knowing that you could have a foot issue, bunion issue, or any type of gait issue, and it can negatively affect this is huge, huge. So does that mean that when somebody comes in with high blood pressure, blood sugar, type 2 diabetes, high cholesterol, okay, sleep disturbances and anxiety, I say take off your shoes? Yeah, I do. And they'll go in and they'll say, well, yeah, but bunions run in my family. And I say, that's crazy. Bunions don't run. Okay. You know what I mean? It's just we're looking at everything because bodies are always smart. So this is how you find out how to stabilize. Person laying face down, you approximate the hips, just squeeze them together, and they're going to say one of three things. Don't feel any difference? Cool, your pelvis is probably stable. They do feel a difference where it feels better. Okay, it's probably unstable. We're going to give you trochanter support. You squeeze them together, and they go, ow! Okay, that's a really inflamed sacroiliac joint, and that requires a trochanter support, but only at short periods of time. But again, it's such a simple exercise. And you can even play with this too. If you have a lower extremity problem, like a foot, knee, or hip problem, and you're not sure if your pelvis is unstable, sit on the edge of the chair and open the legs up really wide. Just like mom told you not to do. Okay, but you're sitting on the edge of the chair. Your mom told you that too. Okay, yeah. Okay, but what that does, it moves the legs out and it approximates the pelvis so it can take the stress off. Does that make sense? 99% of the time, muscles are never the problem. Muscles are never the problem. You can go in there and you can relax the psoas. You can stretch the piriformis. You can massage the glutes. I know, first buy them lunch and candlelight dinner and stuff if you're going to get in that area. I got in trouble for suggesting a foot massage. Yeah, so I thought that was just cool. Sorry, I didn't mean anything by it. Okay, but when you're looking at muscles, it's what controls the muscle. Okay, the muscle is going to be firing off for a certain reason. So now here, we're looking at before and after, and you're going to see minimal changes. But it's not just the hip that's limiting the change. There's going to be a disc issue. There's going to be some other contributing factors. Do you think that the hip biomechanics could be corrected by restoring the arches of the foot? Do you think that assessing for disc injuries might also change that? Yes? Doesn't it make sense? Okay, so now a calf stretch, and this is one of the things that you're going to see a lot. This is a 4x4. You get it from Home Depot. Okay, we get them in 12-foot lengths and have them cut in 5 7/8 inch long. Why 5 7/8? Because it comes out even. The saw blade takes up 1/8 of an inch, and I can get an even number out because my mama raised me cheap. Okay? If it's 6 inches, you're going to lose one at the end. Okay, so 5 7/8. Okay, and you'll put the ball of the foot up here, heel on the ground, and stretch. Okay, basic, simple. But what you're going to find out is most teenagers don't have the ability to do this because most teenagers today are vaccinated, and that can cause inflammation. And what are you going to get? You're going to get toe walkers. Okay? And that toe walking that you're going to see walking down, that is brain damage. Okay, so when they go to do this, and my knee goes over the toe, and they're not able to do it, you say, look, you know, and be honest with them. Say, yeah, you were injected with things that cause your body to react in an inflammatory process. And this inflammation does negatively affect your gut and your brain. Your brain has a neuroplasticity, and we can get it back. Okay, but you got to be on a healthy diet. We're going to heal the gut, and we're going to get the body working. And this is one of the exercises you're going to do to restore your gait. Does that make sense? It's honest, clear, direct, and at least people will get the big picture. But you'll see the workout girl in the middle? She's trying to stretch her foot. She's doing everything she can, but that foot's barely bent to 90 degrees. It's supposed to bend to 125 degrees, and she's not bending it that way. Now, if you have compression of that hip, how about we distract it? And this is the neatest thing about how your body is. When you take a step, your leg dangles in the air, swings, and so there's a negative force loading on it. When you stand on it, there's a positive force. When you walk, there's a negative, positive, negative, positive, negative, positive force load. Okay, and that's kind of cool because when you understand that each joint is a capsule surrounded by, two bones coming together, surrounded by a capsule. And if you create a negative force loading in there, that's going to suck that superfiltrated blood called synovial fluid inside of that joint. So just walking fills your joints up with fluid. Isn't that cool? Except if you have a problem with the muscle on the back of the leg, okay, called the calf, and it's called the soleus muscle. It's underneath the gastrocnemius. This is the pump. If that pump isn't working, the knee, the foot, the ankle, everything's going to desiccate or dry up. So what you can do here is distract it. And this is the same way you're going to distract the hip. I'm going to show you how to sit and distract the knee, but that distraction creates a negative pressure and strains the ligaments. That's what you want to do. You want to cause inflammation. Oh wait, what did that doctor say? It's so weird that the cortisone, dude, it shrinks inflammation and stops the production of new tissue. So it caused more damage, dude. I guess inflammation might be good, dude. Okay, he didn't really say that, but if you got a doctor that really doesn't understand that inflammation is the healing process of the body and that's how the body initiates healing, and it happens every time there's tissue damage, anytime you break a cell, histamines are released, buddy, that's the start of inflammation. Your body is that friggin' smart. You break a cell, boom, man, inflammation. Of course, you cause something to be damaged, that's systemic inflammation, and that's really not good. So this is what you're going to do if you have a compressed hip. Now, if you have a compressed hip, should you do this with a trochanter support or without? You're standing only on one leg. And more than likely, if you got a messed up hip, okay, your pelvis is unstable, right? So you've got to have a trochanter support on. And then you want to have this swinging just back and forth, very, very passively. This isn't a muscle exercise. So you'll see the heel is level with the toe, then the toe is level with the heel. So super gentle, super easy. Okay, does that make sense? These are some of the tricks you can use. I mean, we use a foam piece, okay, which is pretty firm, but it's very light, so you can throw this at anyone that you know, throw it at your TV set when they say, oh yeah, they're taking away the religious exemption rights in New York, and soon that will happen to every state in the union, and soon you'll be forced to comply. Throw it at the TV, you'll feel better. And there won't be anything wrong with it because it's very light foam. But it's, oh yeah, and it's still compressible, okay? So it has a bit of strong force in there. We used to use rolled up towels wrapped with rubber bands. That works too, but where it's gonna go, the bottom of the elbow is the bottom of whatever you're gonna use, okay? And you could use a liter bottle of water from IKEA. Okay, it has a similar diameter. Okay, so that works. Just anything. But now it takes 20 minutes to cross what's called the plastic elastic deformation curve. That means if you put any material under a force loading, it pretty much retains its original shape. That's called an elastic deformation. But if you put under a greater force loading for a greater period of time, it can retain a new shape. That's called plastic deformation. Now, human tissue crosses that, you know, so it's just enough time, and then it starts to change at 18 minutes. This is why you hear over and over and over again, yep, it only takes 20 minutes of exercise a day, because they're talking about the plastic elastic deformation curve. So this has got to be in there 20 minutes in, 10 minutes out, 20 in, 10 out, 20 in, 10 out, the whole time you're sitting. You never want to lay on your back with both your legs bent like this for a long period of time. Why? Because when we look at the low back, okay, it's curved. And the disc spaces here should be narrow at the back, wide at the front. Now the nerves exit the back. So when you flatten this out, oh my goodness, does that feel good? Because you're opening up all the holes where the nerves come out. However, now the discs are all reversed. They're wide at the back, narrow at the front. So that means that you're going to feel really, really good when you're laying there and you go to get up, it's off. So, and it's literally every time you're sitting, standing, or sitting, and this is sitting, driving, doing everything, you're flattening out the disc in the low back. So if we have a lifestyle where you're sitting a lot, that's going to be a challenge. The ball chair is a good option. Doing the Cobra is a good option. Doing these exercises, they're, you know, reasonably good options. But just look at the spine gets its strength from the curves, not really from the muscles. So things that you should not do. No hip rehab without looking at the foot and calf mechanics. Does that make sense? Okay, and I mean, you know, I'm not to the point where I want to get this tattooed on my arm, but can you make sense that this should be standard protocol? Look at the whole body, okay? You got to look at the lumbar and pelvic correction, because if you had a hip issue, you got to look at the knee, foot, everything. It just makes sense. No ice on chronic hip injuries, because that doesn't make any sense whatsoever. Inflammation is how the body heals. And if you put heat on something, what color does that something turn? Red, because the brain senses that difference in temperature, so we're increasing the blood pressure to that area. Now, since we know that every bone or every joint has two bones coming together surrounded by a joint capsule, and you got a superfiltrate of blood in that joint, if you put heat on that joint, guess what happens to synovial fluid production? It goes up. That's a good thing. So that's cool. I mean, no, that's hot. Cool meant in like a, you know, dark glass listen to jazz music, okay? Okay, but I mean, so it's a good thing to have moist heat on there. It just works better. And eliminate prescription drugs that can cause your body to be damaged. And they don't work anyway. There's other pain relievers that you have on the list there that I gave you. I mean, you can get omega-3s, fish oil help. You can get turmeric, that helps. You can get juicing, blending, the antioxidants in there help work with it. And when you look at the difference between a chemical anti-inflammatory that stops the healing process and plant products, those have extra electrons to deactivate any free radicals or any negative that can happen from the inflammation, it just makes sense. Now let's look at the knee. I've broken my right knee twice and my left one once. I've had 4 knee operations. When I was 23, I fell off a 3-story building, shattering my right kneecap into multiple pieces. Okay, when they healed up, they didn't heal up level. Okay, so they went in, thank God for, and believe me, you will never see a bigger fan of surgery than me, because that knee cap fused together in multiple different pieces. They went in there the next day, ground that sucker down after I'd been limping for a couple of months, and I felt like dancing. Okay, so I mean, that's miracle stuff. And then about 10 years later, I'm walking across the street, get hit by a car, and both my knees get broken. So I'm familiar with knee injuries. Anybody got a bigger story than that? Nobody? Nobody? Okay, yeah. Okay, so I've just established myself as really good at understanding knees, okay? But also, when you look at it, how it regenerates. Because, I mean, I had the advantage of working in a human dissection lab where I could look at knees of an 80-year-old cadaver, of a 20-year-old cadaver. I could look at all these different knees. And I'm not seeing degeneration. I'm seeing an adaptive process. And it always begins from altered mechanics and altered blood supply to that joint. And I'm going to show you a couple of things. But first, I want you to look at the way the knee works. It doesn't work like a hinge. It works like a screw. Okay, it moves twice as much on the inside as it does on the outside. So that weird little thing with a circle and a big C shape on the bottom right there, the medial aspect, or the inside, is that large C-shaped thing, and it pivots more on the outside. Now, the meniscus is different. It's like a thick Tupperware covering. And this is where doctors get stupid again. Okay, they say, well, the meniscus doesn't have any blood vessels, so it's avascular. No shit. You're standing on it. Okay, you got the weight of the femur crushing down on it. If you had any blood vessels in there, would they be healthy or squished? They would be squished. That would be a poor design. Okay, but now so you got to walk these people through. Okay, yes, I know there's no blood vessels there. Okay, that it makes sense. The design would not like that. Okay, but is it alive or dead? And they'll go, well, it's alive. Okay, good. So they have to get nutrients. They have to take in nutrients, produce proteins, eliminate waste products. Do they get it from the synovial fluid? Well, I never looked at it that way. Okay, yes, they do get it from the synovial fluid. So they're not acellular. The cells are there, and the cells can reproduce. Okay, does that make sense? However, on the middle aspect, the medial meniscus is attached to the medial collateral ligament. And now there's a thing called the terrible triad of Donahue. When somebody gets, bam, blocked from the outside, it opens up that middle aspect, and you got the medial collateral ligament, the medial meniscus, and the anterior cruciate ligament all tear at one time. Yeah, that's terrible. Terrible triad of Donahue. Yeah, but luckily, meniscus can change. But what I want you to do, we're looking at a couple of different knees here. We're looking at a 58, 75, and 45-year-old. Now, they were all told they need knee replacement. And you might look at the 75-year-old and say, damn, it looks like a pretty good space there. Okay, but also, I want you to look at the white little shadow thingy. That white little shadow thingy is the patella. It's the kneecap. It's supposed to be in the middle. Okay, so is it in the middle in all of them? No. So that means that we have a patellar tracking issue. And that has to be coming from the low back, because that quadricep, that big old friggin' muscle, has got muscles on the inside, muscles on the outside, vastus medialis and lateralis, and it's not firing the same. So it's really a low back issue contributing to this. Does that make sense? Now, knowing that if the foot is flat, then the person's not going to have good dorsiflexion or movement of that calf. So the pump on the back of the leg is also going to be not functioning correctly. Never, never have I seen beautiful movement of the calf and a messed up knee. There may be somebody someday that'll have beautiful calf flexibility, fantastic biomechanics, a fantastic looking foot where that big toe is going straight, and they'll have a messed up knee. I haven't seen it yet. So the knee, what came first, the knee or the foot? I don't know. But just know that the patellar tracking has to be corrected in order to get this. And this is also what you'll see in people that have had knee replacements and their knee still hurts. Okay, because it wasn't just the knee problem. And you'll see this person standing up, how the body curves off to one side and curves off to the other. The middle part of the low back, the lumbar, L3 is what supplies the knee. So when we look here, again, we're looking at the overall person standing up. You got a 12 to 15 pound head laterally translated. Do you think that changes the force loading of the low back? Yes. Okay, do you think that, I mean, just sit in your chair and slide off to the side a couple of inches. How does that make your back feel? A little funky. Okay, how'd you like to walk around like this for a while? You're gonna see some abnormal force loading. Here's another patient. Okay, we're looking at a reverse curve in the neck. So now not only is the head laterally translated and messed up, but they're forward and reversed. Do you think that changes the force loading on the knees and the feet? Absolutely, and we're looking at an abnormal patellar tracking because that white patella is off to the side. Can you see this? And I just want to get like all the doctors that are going to watch this, which is probably going to be like one, okay? Because, you know, they've already been taught, we know the cause of this, it's non-steroidal anti-inflammatory deficiency. And I know that I can inject everyone with cortisone and they'll be dancing. Yes, I mean, it's nuts. Okay, let's just appreciate it. So when you're looking at knee replacements versus a regular knee, you may need it. In fact, the doctors told me when I had my fourth operation, okay, fourth arthroscopic operation, first one I needed. The second one, they just said, oh, the meniscus is torn. Okay. I didn't know anything. I wasn't a chiropractor at the time. Okay, it's torn. Well, get it out then. And it felt less stable. And then the next operation, it felt less stable. And the next operation, it felt less stable. And then common sense kicked in. Okay, I'll explain that to you younger people. Okay, but it kicked in and I started to think, hey, wait a second. They're not putting stuff in. They're taking stuff out. No wonder it feels unstable. So why am I popping and cracking? Why am I bending and turning? Why does it feel funky? So then I thought, well, what if you put that knee under a distractive force? What if you strain the ligaments? If you strain the ligaments, wouldn't they regenerate? And then what's a bruise? Anyone ever seen a bruise in here? Okay, good. Does it there forever or does it go away? It goes away. So what that is blood proteins in an area that shouldn't be. Okay, and you could have damaged tissue, and the body has these little cells called big eaters, macrophages. They go in there, they chew up abnormally placed proteins, put it back in the bloodstream so your body can reutilize those proteins, nothing gets wasted, cool system. And then you look at this and you think, well, if I got torn tissue, my body's always taking care of it, why would the knee be any different? So can meniscus be repaired? It can. It can. Torn tissue, can it be regenerated? Yeah. Turns out God didn't screw up on the body. He did a good job. Okay? Except for the vaccine thing. Okay, so now this is how you check for patellar tracking. It's really, really simple. Okay, first, where's the problem coming from? The low back. The quadriceps isn't firing correctly, so you got to fix the disc in the low back. But since this quadricep hasn't been firing correctly, you may need to change it. So you take the legs, stretch it, you hook that kneecap or patella, and you pull it down. But you're going to pull it down from the outside to the inside to check vastus lateralis. See, this is the outside of the leg. And from the inside to the outside, pulling it down. And if you pull it and it doesn't hurt, cool. If the muscle is weak and you're able to pull it and it causes exquisite discomfort, that's like, oh! Okay, then you know that that muscle is too weak. Okay, really, it works. And so it's super simple. You just kick your legs up just like this in order to strengthen the muscle. Okay, if it's, you turn it out, if it's vastus medialis weakness, turn it in if it's vastus lateralis weakness. I mean, really simple. To strain the ligaments, you want to just dangle it. And I mean dangle it. But before you do this exercise, should you have healthy blood supply? Yes or yes? Should you have healthy nerve supply? Abso-friggin-lutely. Should we restore the biomechanics of the foot so you have good gait? Yes. Should we stabilize the pelvis? Absolutely. Should we fix the sleep problems, the nutrition problems, everything in here so the blood is clean and healthy? So when we cause that inflammatory response, that the body knows to regenerate the ligaments and you got the right materials. Does all this stuff make sense? Because it works. You'll see ligaments regenerate. Again, you're looking, even though the patellar tracking still isn't fixed on this, we're looking at an increase in the joint space. We're looking at the problem in the low back, and you can see this low back is messed up. Okay, but the apex of that curve is L3, and that's the nerve that supplies the knee, and you're seeing a slight correction there. So when you're looking at this, okay, again, altered mechanics from a foot, is that going to change the biomechanics of the knees? Absolutely. So now let's look at the spring. Bunions do not run in families. Altered biomechanics do. If your parents were sedentary, you're going to be sedentary. If your parents were gymnasts, you're probably going to be gymnasts. Okay? So when we look at the feet has a spring, it really is. Bunions is not a bone growing. It's the muscle around it atrophying. Okay, so anytime you see a bunion, that's compromised nerve supply to the foot. It's not from wearing ridiculously hot shoes. Okay? Because I'm telling you, yeah, I have 3 sisters and a wife. There's no way I can tell a girl, no, you can't wear high heels. Because girls, do you feel like ridiculously pretty in them? Yeah, you can't walk down streets with them. Like if you walk down, a sidewalk, you're going to be walking funky, but they look great. From the guys in here, I know it's hard to understand that shoes look great, but you can't walk in them. Okay, the guys are going, that really doesn't make sense. I know, but the girls are going, shit, that makes sense to me. Those look hot. I don't need to walk that far. So it's not the shoes that cause bunion formation. It's the compromised nerve supply to it. So what do? You restore the nerve supply to the foot, you restore the biomechanics of the foot, you stabilize the pelvis, and then you start doing toe curling exercises. If you're really cool, you can get a shoe like this that has full flexibility and toes in it. It works really good. However, when I was checking out of the hotel at the clinic in Mexico, there was about a 2-year-old kid that saw my shoes and they looked at it like this. And I thought, okay, I'm going to play with them. So I wiggled my toes and she thought it must have been like monsters or something. She went, "Wah!" It was, I'm sorry, I scared your child. Okay, but it was kind of wild. So all of this stuff is compromised nerve supply to the foot, the claw toes. None of this stuff is hereditary. You don't pass on bad shit. Okay? There's no species evolutionary positive from having bunions or clawed feet. This is compromised nerve supply in the low back. This is a pelvic instability. This is a pelvic problem. So what's the solution? Walk, play, barefoot. Okay, and also, now if you have, say, upper motor neuron lesion, okay, MS, Parkinson's, let's say that you're vaccine damaged and you're trying to get the brain working correctly. If you start walking barefoot in grass or hard sand, you're going to get a massive change in the brain function. And you see the people with Parkinson's, they need more sensory input into their brain. You get their shoes off, you put them in grass, and you're going to see a way better change in gait. And if you get that gait change and you get more information up to the brain, you're literally altering brain function. When I know it sounds amazing because I'm talking about restoring the arch of the foot, restoring the nerve supply to the foot, and this alters communication to the brain. And it happens. It happens all the time. Just start. Okay, specialty shoes. Yes, those are high heels and rock climbing shoes. Yeah. 20 years ago, man, rock climbing was a blast. Okay. Now when we talk about 5 keys to health, you look at everything. Okay, the proper nerve supply, and this could be everything. Regular exercise, barefoot walking, stretching, resistance exercises, everything, every day. And this helps brain function. Proper nutrition, that means because anything that you put in your mouth becomes you. That's right, the Tylenol, the Advil, the Roboxin, the muscle relaxant, everything, all of that has to be filtered through the liver. This is a chemical society, and it's the sickest society the world's ever seen. If man makes it, you don't friggin' eat it. Okay, sufficient rest. I'm thinking about doing that next week. Honest to God, last night I was supposed to work on this talk, and it was 7:30 at night. And it was just like, I finished my last phone call to Canada like 6:45, and I'm done. Okay, so in prayer and meditation, thank you, God. Okay, now go to Extreme Health Academy. This is the forums. If you've had any kind of health challenge, I guarantee you there's somebody on this group that has met it, and found solutions. And that's what we're all doing. That's why I'm doing this videos, to help doctors and people understand, oh my God, that makes sense. This is the solution. It's not drugging myself. Puerto Vallarta, I don't know if it's booked up yet though, but we just found out that we can get continuing education on it. So that's going to be kind of fun. And then cruise, so that means any healthcare professionals can, get credits along with great sun and a couple of margaritas. Okay. The cruise, 2020, that's going to be up next year, and what do you see the speakers we got there? I got a couple of guys lined up. And our video database. You got to check out, we just redid the site, and it's pretty cool. Oh, we don't have, okay, I could take 3 questions. Yes, sir.
Will the wrong pillow sleeping at night contribute to forward head carriage?
Will the wrong pillow sleeping at night contribute to forward head carriage? I got the only mic, so I got to repeat it. Yeah, kinda. Okay, because if you're having a head forward like that, that's going to be straining a lot. Again, I have the only microphone, so thank you for letting me repeat. I know it's all about you, my brother. Okay. Well, think about this. Think about people that have had surgery, okay? They have to have this. People with spinal distortions, they have to have forward head carriage. So you have to look at it. Getting that curve back in the neck is the key to taking pressure off the brainstem. Ideally, your pillow will allow you to have an appropriate curve, but you know what they'll teach you in school? I don't know if they taught you normal. But I would teach my students, I said, okay, what's the appropriate position for a person to sleep in? And some people will say, well, never sleep on your tummy. Always sleep on your back. Sleep on your side with a pillow between your legs. And I said, okay, what if you've got a lateral deviation of 20 degrees, forward head carriage of about 25, 30 millimeters, and you've got an unstable pelvis and a hip issue? What's the best position for that person to sleep in? Nobody knows. Okay? And that's how most of us are. Find something comfortable and you'll be okay. Don't sleep in a lazy boy recliner. Don't sleep on your back with your legs bent. Those are contraindicated. But based on the structure, as you go through and change the structure of your body, you're going to find different sleeping positions comfortable. On your back without a pillow might be comfortable for you. I like the buckwheat pillow. Okay, just because, my shoulders are big, and if I sleep without, I feel uncomfortable. I like about a 3-inch pillow coming up, and on the side, I like to stuff it up so I've got a good distance there. Okay, yes, sir.
Why does it take longer to heal an arthritic hip than it does to fix a broken bone?
Oh, why does it take longer to fix an arthritic hip than to heal a broken bone? A broken bone, you're looking at 4 to 6 weeks. And that's because the matrix is already there. You got a fresh, healthy matrix, it breaks, you got an inflammatory histamine response because you break the cells. If you're really lucky, then you could put it back so the ends are touching. But even if it's like this, it will still grow that way. I could show you a whole bunch of clavicles that were broken like that and fused like that. Okay, so it's not connected.
4 to 6 weeks.
4 to 6 weeks for a brand new bone. Now a hip that's degenerated, that degeneration, it takes 3 to 5 years to see bone changes on an x-ray. So when we're looking at distortions of a hip up there of 3/4 of an inch, you're looking at more than 20 years of damage. So you're not breaking the histamines, okay, or breaking the tissue and reforming a new one. That bone spurs or adaptations or distortions is the body changing over 20 years to allow you to function correctly, okay? So you have to put that along a normal force loading, cause tissue damage, strain it, break the matrix, regenerate it, so it's a whole different remodeling process. Typically it takes about half as long to fix it as it does to lay it down, but that is about as rough a guide as you're going to get, because you got to fix the physical, chemical, and emotional stressors that go along with that, and plus you got to cause multiple inflammatory responses, multiple tractions, distractions, everything. Like when we're working on a hip, do you know what it's like to work on a degenerated hip? You've got someone laying face down. I'm contacting the ischial tube, which is the butt bone, okay? And then I'm contacting the ankle, and I'm literally stretching out as hard as I can. And then we set a drop mechanism when I palpate the gluteus medius, when I feel that change in tone. And then we drop on it multiple times. And then the patient's still laying face down. I'll grab the knee, I'll lift it up, and I'll drop it in a scissor action. Why are we doing that? To create inflammation along an axial force loading and lateral force loading. Then we lay them on their side, and then I'll move it back and do another drop, and forward and sideways. And then we lay them on their tummy. I mean, it's a good workout, man. You know, I got a pretty good upper body now. Okay, but then I'm grabbing that. I put the ankle in between my legs. I contact the front part of the pelvis, the ASIS, and distract it out. And we'll vibrate on the side. So we're doing multiple planes of motion, multiple traumas, multiple inflammatory responses, along with the 10 cycle a second vibration to relax the ligaments. And we do this 3 times a day, 5 days a week. Within 2 weeks, we'll get post x-rays and show some changes. But to see the osseous changes, you're looking at 2 to 4 years.
But to feel the change.
To feel the change, it totally depends. It depends on your physical, chemical, and emotional stress load that you have. So if you are stellar diet, everything's perfect, fantastic, you're going to have a faster response than somebody who has a lot of physical, chemical, and emotional stressors. There's going to be other things that can contribute to it. Good. One more question. Yes, ma'am.
How long after you've corrected the problem with the spine does it last? Or will it go back to the way it was before?
How long, when you correct a problem in the spine, will it last? It lasts until we do something stupid. Okay? This is actually a really good design. The facets are set 30 degrees, okay, 60 degrees, and 90 degrees. The spine gets its strength from the curves. So if you have a lateral deviation from a trauma and you put it back, the body's in harmony and it's going to stay there. But now let's say you sit on this bone and you have a 15-pound head and you go from 0 miles an hour where you're sitting, so you're increasing the pressure on the L5-S1 disc 5 times normal. Golf increases it to 8 times normal. And then you depress your right foot and you accelerate from 0 to 50 miles an hour, okay, straightening the curve in the neck. Then you see a little dog, you slam on the brakes and you decelerate from 50 miles an hour to 0, throwing that head forward, causing a straightening of the curve in the neck. And this is a person racing to get here for the health talk. So, altered biomechanics, that's why. What do we give? We give neck curve exercise, everything else. It's like, how long will teeth last? You know, could be a lifetime. Might not. Okay, but your body is designed to be healthy forever. It's a good design. Thank you very much.